Hi everybody, this is Dr. Eliana Aaron, Director of EMA Care. Today we're going to talk about playdates and having your kids socialize. Obviously, children socializing is very important, and this lockdown that most of the world has been through has been very challenging for everybody, including us, but our children especially, because it's very much part of their development. Like, we can rationalize not seeing our friends, but our children really have a difficult time with this. And once we're in a place where things are better, so this might not apply to all of the countries of the world and all the states of the United States, but certainly in some areas it is, people are starting to get their kids together and there aren't really any regulations about this. So part of this is really using some good judgment. So I'm going to give you some guidelines that might help you make good decisions so that your kids can see their friends again. And in a safe way. So first of all, we're going to divide this up into age groups because each age group has different social needs and also different capabilities as far as keeping to regulations and being able to realistically maintain them. So when we're talking about young children, preschool age children, most of the time they see their friends in school. They don't really need play dates because they play with their friends all day. That's what they do. And they come home, they take a snack, they eat, they bathe, they read a book, they go to sleep, and they don't really need to have a lot of play dates. On Shabbat, some people would say we want to have a play date on Shabbat. So a play date on Shabbat for this age group would really mean that you have to look at how safe the parents are, how clean they're keeping things, are they washing their child's hands, and building some kind of a program in your mind of what kind of kid do I want my kid playing with. But the truth is that at that age you don't need a lot of play dates. They're pretty happy staying at home and just hanging out when they're not in gun or nursery. When you're talking about young school age children, so children who are still very much dependent on their parents, very much can't go anywhere by themselves, they're not latchkey kids yet, they're too young. They can't really make their own snacks and food, and the parents are really very much involved in all the aspects of their lives. So this would normally be approximately kindergarten through third grade, or possibly first through third grade. So children this age need to have a social life. They need to see their friends. It's very important for their development. And when there's a lockdown, obviously they can't do that. But when there's no lockdown, then things open up a little bit more, and we have to sort of think about how to build that so it's safe. So the first thing is that children this age really need to be exposed to a minimal number of children. If they're in school, if all the children are in class, then stick to kids who they are already in class with. So in Israel, in the places where there still are schools open, and of course we know that there are lots of schools that are not open right now, I would pick 2 or 3 friends from their class that you know the parents, that you know that they're being careful, that you know that they have a similar outlook to this illness and the spread of this illness as you do, so that you don't have too many conflicts, and keep their social structure within these small groups, or let's call them capsules. You're building a social capsule for your child, which gives them some exposure to these children, and that you're kind of screening who those kids would be, and coming from families where they are actually keeping to the regulations for masks and social distancing. Don't be afraid to ask people, and ask them questions. Everyone, if you say to someone, are you keeping to the regulations? Everyone's going to say yes. But I mean, when I go on the street, I see half the people without masks, so obviously it's not true. So you have to say, do you wear a mask when you leave your house? Do you entertain? Are you inviting people over yet? When people come to your house, are they wearing masks? Are you back at work? Do you wear a mask at work? Do you have, is your work being careful? Do you cover your mouth and nose? Or do you just cover your mouth, or do you cover your neck with your mask? And of course, that's useless. So it's okay to ask these questions. I think everyone has to. Once you select the friends that your kids are going to be friendly with, and play with. If you have an indoor play date, and in the summer sometimes you need to have that because it's really hot outside, especially in Israel, then you have to have those kids playing in a room. And I wouldn't expose your other children necessarily to them, so have them play in their own room. Give them some structure, give them some games. Tell them, try not to have them jumping on each other and actually, touching each other too much. If they're outdoors, you can give them a ball, have them play outside. If you're in a country or a state where a mask is required, you have to make sure that you're dealing with parents who have taught their kids to wear a mask. In the United States, from age 2, you need a mask in most states. So in Israel, it's from age 6. So basically, wearing a mask is a question. So if you're at the age where you need to have a mask when you're outside, then you have to make sure that those kids have a mask, that they know how to wear it, the parents are instructing them appropriately. I would rather kids this age play in a field with a ball than to climb on the swings and all the different things in a park that they touch. Again, when I went to the park with my granddaughter, I went extremely early in the morning when there was not a child in the park, and I wiped down every single thing she touched with antibacterial wipes, and actually not antibacterial, but antimicrobial wipes, so that I knew that what she was touching at least was germ-free. It's a good thing no one was in the park because I looked a little crazy. I'm cleaning, everything, every surface that she's touching. But it was a way for her to go to the park, and she was very happy doing that. And I felt like, okay, she could touch the swing, she could go on the seesaw, etc. So I did that, but I also cleaned her hands before and I cleaned her hands after. So before play dates, after play dates, you have to wash hands. Before eating, after eating, everyone has to go and wash their hands with soap and water. Supervise it, make sure it's being done correctly. Once you're talking about older children, so you're talking about kids who have some independence, they can make their own food, they could make their own snack, 4th through 7th grade, let's say. So older kids, but not quite adolescents, or beginning of adolescence, those kids same thing, you're building a capsule, you're choosing 2 or 3 friends, and you're making sure that the regulations are being kept. I would have them be, again, separated from the other children in the family. Try to have, them do activities where they could be somewhat spaced apart. If they go to the park, or if they go to a pool, or if they're in the sprinkler, or whatever else they are, that they are somewhat away from each other. They have to wear masks at that age pretty much in every country. Obviously, if they're getting wet, they can't wear a mask. If they're eating, they can't wear a mask. So hygiene is really important before, during, and after. And just, it's like, okay, guys, here we're spritzing. Everyone, it's been an hour, let's spritz, let's clean our hands. And I think it's important to make sure that, the parents are okay with you doing this. And I think most parents would be. I think that when we're talking about kids who are older than that, again, for kids like that, give them a ball, take them to the park, let them throw the ball around, keep the ball clean, obviously before, wash their hands before, but once we're talking about adolescence, the number one problem I see, and it drives me completely crazy, is teenage girls love to hug and kiss each other. I don't understand when this became in style, but it's been going on for probably 30 years or more, and it's a great germ spreader. So teens tend to be the least compliant of all the age groups. They are very much touchy-feely, more than other populations probably, and keeping socially distanced is therefore more challenging. I think when you're dealing with kids that age, they don't have play dates anymore. They want to see their friends. They want to hang out with their friends. Number one rule is educate your children. Children that age are old enough and mature enough to understand, to a certain extent, or maybe to a full extent, of what's going on, why it's important, what the results or consequences are if they don't follow these rules. Having them take personal responsibility for their behavior and their lack of behavior. So their action and their lack of action. They're wearing a mask versus not wearing a mask. what the impact of that would be. And make sure that as much as you can that they are befriending and hanging out with people who are like-minded as you. Hygiene, obviously. I think it's also very important to teach them there's no hugging, there's no kissing. You just don't do that. That's what you have parents for. Let's just hang out. Let's be happy we're hanging out. For this population who are high spreaders, so the little kids are not really high spreaders. The older kids, they're high spreaders. They're spreading it. It's hard for them to keep away from each other. You could tell them to. They don't always listen. Again, educating your kids is the key here. Try to get them as much as possible to be outdoors, because outdoors is safer. They need to have masks on. They need to socially distance, and they can hang out. They can sit on a bench outside, at the ends of the bench, and they can talk to each other, and they can hang out with each other, but wearing a mask and, being very careful. If they go out and they want to eat something, they're having an ice cream, they're having pizza, whatever it is they're having, they have to wash their hands before and after. And they have to keep apart so that when they're eating and all that, they're not breathing on each other. So I think it's really important to empower your children to take responsibility and to have consequences if they don't follow the rules. Okay? Teenagers are able to understand consequences of their actions if they're enforced. So if you don't wear a mask, you can't visit grandma. Okay, you definitely can't visit grandma. But you could be causing us to get sick. We don't know, and you could end up harming your grandmother, or your grandfather. So I think it's very important for people to know that, and to also understand a lot of these young people, when they get to be a little bit older teenagers, they think, oh, but like people my age, they don't really get that sick and they're fine. Coronavirus causes lung damage. It causes long-term effects. And it's very important to keep that in mind, that your health could be affected for the rest of your life because you decided you don't want to wear a mask. So I think, or your friends decided they don't want to wear a mask. So educate your kids, keep them healthy, keep them in capsules as much as you can. And please take care of yourselves. I hope this video has been helpful.